Garlic, an ancient remedy, a beloved flavor, and a symbol of good health. But have you ever wondered if there's a side to garlic no one talks about? While it's praised for its countless benefits, garlic can have surprising effects on your body, some of which might not be so pleasant. From interfering with medications to causing unexpected discomforts, it's not always as harmless as it seems. Stay with me as we uncover the lesser-known side effects of garlic that could make all the difference in how you use it safely and wisely. 1. Garlic and digestive distress. Have you ever enjoyed a delicious meal loaded with garlic, only to feel that uncomfortable bloating or stomach ache shortly after? You're not alone. For some, garlic can be a bit too intense for the digestive system, especially if consumed in large quantities or on an empty stomach. Its compounds, particularly fructans and sulfur, can ferment in the gut, leading to gas and that familiar bloated feeling. Now, imagine this happening to someone with a sensitive stomach or a condition like IBS. It can turn a simple meal into an ordeal. For those with acid reflux, garlic can aggravate symptoms by relaxing the lower esophageal sphincter, allowing stomach acid to creep back up. This is why some people report a burning sensation or discomfort after eating garlic-heavy foods. And let's face it, my friend, nobody wants their favorite ingredient to be the cause of a sleepless night. The solution isn't to cut garlic out completely. That would be a tragedy for your taste buds, but to use it mindfully. Start with smaller amounts. Cook it thoroughly to reduce its sharpness, and pair it with foods that are gentle on the stomach, like rice or yogurt. And if your digestive system is particularly sensitive, consider garlic supplements in an odorless, easier-to-digest form. Moderation, as always, is key. 2. Garlic breath and body odor. Garlic, the flavor powerhouse that can leave behind a souvenir long after the meal is over. We've all been there, leaning in for a conversation and suddenly realizing that last night's garlic bread has overstayed its welcome. The culprit? Sulfur compounds like allicin, which give garlic its incredible health benefits, but also linger in your bloodstream, lungs, and even sweat glands. While garlic breath might be a running joke among friends, it's a real concern for many. Imagine sitting in a meeting or chatting with a loved one, feeling self-conscious about that unmistakable aroma. And it's not just your breath. For some, garlic's scent can even seep through the skin, creating a subtle but persistent body odor. Here's the good news. You don't have to give up garlic to avoid these side effects. Chewing on fresh parsley, mint leaves, or even a slice of apple after your meal can neutralize odors naturally. Drinking green tea or milk with your meal can also help, as these contain compounds that counteract garlic's sulfuric punch. And if you're planning a garlic-heavy dinner, maybe keep some breath mints handy. Your friends will thank you. 3. Garlic allergies. Now, let's talk about something less common but equally important, garlic allergies. While garlic is a culinary treasure for many, for some, it's more of a troublesome guest. Symptoms can range from mild skin irritation to more severe reactions like respiratory discomfort or even hives. For people prone to allergies, especially to other alliums like onions or leeks, garlic might trigger an immune response that feels far from friendly. Have you ever noticed a rash or itching after handling raw garlic? That's one of the telltale signs of contact dermatitis, a localized allergic reaction. In more serious cases, consuming garlic can cause digestive upset, swelling, or difficulty breathing, symptoms that should never be ignored. If you suspect a garlic allergy, the first step is to avoid raw garlic and opt for cooked versions, which are less likely to cause a reaction. And always pay attention to ingredient labels, as garlic can sneak into unexpected places like sauces or seasonings. If symptoms persist, consult an allergist for testing and advice. With a little caution, you can still enjoy your meals without sacrificing safety or flavor. 4. Interference with medications. Garlic is often hailed as a natural powerhouse for health, but did you know it can clash with certain medications? Its blood-thinning properties, while beneficial for reducing the risk of clots, can be risky for individuals taking anticoagulants like warfarin or aspirin. Imagine this. Your blood is already thin due to medication, and then garlic amplifies the effect, increasing the risk of excessive bleeding. Even a small cut could become a bigger problem. And let's not forget the potential for complications during surgery if garlic consumption isn't managed beforehand. But that's not all. Garlic can also interact with medications for blood pressure and diabetes. It's known to lower blood pressure naturally, but combined with antihypertensive drugs, the effect could push your blood pressure too low, leading to dizziness or fainting. Similarly, garlic can enhance the effect of diabetes medications, causing blood sugar to drop to dangerous levels. If you're on any of these medications, moderation is key. It's always a good idea to talk to your doctor about how much garlic is safe for you. Sometimes, even the healthiest foods need a bit of careful planning to fit into your routine without causing unintended side effects. 5. Heartburn and acid reflux. Have you ever savored a garlicky dish only to find yourself regretting it later with that all-too-familiar burning sensation in your chest? Garlic, for all its deliciousness, can be a real troublemaker for those with GERD, gastroesophageal reflux disease, or frequent heartburn. You see, garlic has a sneaky way of relaxing the lower esophageal sphincter, the muscle that acts like a gatekeeper between your stomach and esophagus. When it relaxes too much, stomach acid can rise back up, causing that uncomfortable burn. For some, this reaction is mild, while others might experience significant discomfort, especially after consuming raw garlic. Cooking garlic can reduce its potency, but even then, it might still trigger symptoms for sensitive individuals. If you're someone who struggles with acid reflux, it's worth experimenting with smaller portions or avoiding garlic altogether during flare-ups. Here's a tip. Pair garlic with foods that help neutralize stomach acid, like whole grains or leafy greens. And if you're preparing a meal, consider roasting garlic instead of using it raw. It's easier on the stomach and still packs a lot of flavor. Remember, enjoying garlic shouldn't come at the cost of your comfort. 6. Skin burns from topical use. Garlic isn't just a kitchen staple. Many people turn to it for its supposed healing properties, applying it directly to the skin to treat warts, acne, or other conditions. But here's the catch. Raw garlic can be far too harsh for direct application, often leading to burns or severe irritation. It's like trying to tame a wild flame. Without proper care, it can do more harm than good. This happens because garlic contains sulfur compounds like allicin, which, while potent against bacteria and fungi, can irritate or even damage the skin if left on for too long. There have been cases where people developed blisters or chemical-like burns from using garlic as a home remedy. And if you have sensitive skin, the risk is even higher. To avoid these issues, always dilute garlic with a carrier like coconut oil before applying it to your skin. Better yet, consult with a dermatologist for safer alternatives. A quick chat with a professional can save you a lot of discomfort and maybe even a trip to the doctor. So, while garlic might seem like a natural cure-all, it's a reminder that even nature's remedies need to be handled with care. After all, your skin deserves gentleness, not a fiery experiment gone wrong. 7. Low blood pressure risks. Garlic is often celebrated for its ability to lower blood pressure naturally, which is wonderful until it isn't. For those who already have low blood pressure or are on medications to manage hypertension, garlic's effects can sometimes push things too far. Imagine this. Your blood pressure drops so much that you start feeling lightheaded or even faint. While a mild dip in blood pressure can be beneficial, too much of a good thing can leave you unsteady on your feet and struggling to go about your day. The science behind this lies in garlic's ability to relax blood vessels, improving blood flow and reducing pressure. This is great for many people, but if your baseline blood pressure is already low, adding garlic into the mix might amplify the effects of your medication. For instance, someone on beta blockers or AC inhibitors might find that the combination leaves them feeling fatigued or even dangerously weak. The best approach? Keep track of how your body reacts to garlic, especially if you're using it regularly. A small amount in your meals is often fine, but large doses, like garlic supplements, should be discussed with a healthcare provider. This way, you can enjoy garlic's benefits without risking your health or safety. 8. Overconsumption issues. We all know that too much of anything can be a bad thing, and garlic is no exception. While a clove or two can add flavor and health benefits to your meals, consuming garlic in excessive amounts can lead to some unpleasant side effects. Ever felt dizzy or nauseous after eating too much garlic? That's your body's way of saying, slow down. Overconsumption of garlic can cause digestive issues like bloating, diarrhea, or stomach cramps. This is because garlic is rich in fructans, a type of carbohydrate that can be hard for some people to digest. If you have a sensitive stomach or a condition like IBS, eating too much garlic might leave you feeling more uncomfortable than nourished. And let's not forget the sulfur compounds in garlic. While they're responsible for its health benefits, consuming too much can overwhelm your system, leading to bad breath, excessive sweating, or even skin irritation. To avoid these issues, moderation is key. Stick to 1 or 2 cloves a day and balance your meals with other ingredients that support digestion, like ginger or yogurt. If you're tempted to take garlic supplements, consult with a healthcare professional to find the right dosage for you. Remember, garlic is powerful, and a little goes a long way. 9. Risk for pregnant and breastfeeding. Women. For pregnant and breastfeeding women, garlic can be both a blessing and a concern. While it offers some health benefits, its strong compounds can pose unique challenges during this sensitive time. Let's start with pregnancy. Garlic is known for its ability to stimulate blood circulation, but in large amounts, it might cause issues like low blood pressure or even increase the risk of bleeding during delivery. Additionally, some women experience heightened sensitivity to certain foods during pregnancy, and garlic's pungent nature might cause nausea or discomfort. Now, for breastfeeding moms, garlic's bold flavor can make its way into breast milk, which might not sit well with your baby. Some infants might show signs of fussiness or digestive discomfort after nursing, especially if mom's meal included a heavy dose of garlic. The key here is balance. A little garlic in your meals is unlikely to cause problems and might even boost your immunity. However, if you notice any unusual reactions, whether in yourself or your baby, it's best to cut back and observe. When in doubt, a quick chat with your doctor can help you find the right balance. As with any natural remedy, garlic is best enjoyed in moderation, especially during life stages that require extra care. After all, a happy, healthy mom and baby are what matter most. 10. Impact on blood sugar levels. Let's talk about garlic's fascinating ability to influence blood sugar levels. It's one of those natural remedies that sounds almost too good to be true. Garlic can help lower blood sugar, which is a blessing for many people managing diabetes. But, my friend, even the best gifts come with conditions, and garlic's hypoglycemic properties can sometimes create complications, especially when combined with diabetes medications. You see, garlic works by enhancing the body's insulin sensitivity and reducing the production of glucose in the liver. This makes it a helpful tool for controlling blood sugar levels naturally. But here's where things get tricky. If you're already taking medications like metformin or insulin to manage diabetes, adding garlic into the mix could amplify the effect, potentially pushing your blood sugar too low. The result? Symptoms like dizziness, sweating, confusion, or even fainting, a condition known as hypoglycemia. Now, imagine a day where you're out and about, feeling good, and then suddenly you're hit with that shaky, disoriented feeling because your blood sugar dropped too much. It's a situation no one wants to experience. In the end, garlic is a powerful ally for health. But like any ally, it works best when you understand its strengths and its limitations. Always listen to your body, adjust as needed, and don't hesitate to seek advice when managing something as vital as your blood sugar. After all, it's about finding the sweet spot where garlic works for you, not against you. When to avoid this? Garlic is a powerful ingredient, my friend, but even the most celebrated remedies aren't for everyone. There are times when avoiding garlic is the wisest choice. For instance, if you're preparing for surgery or taking anticoagulant medications, garlic's blood-thinning properties can increase the risk of excessive bleeding. It's also a good idea to limit garlic intake if you experience frequent acid reflux or have a sensitive digestive system, as its strong compounds can irritate the stomach and esophagus. For individuals with low blood pressure, consuming too much garlic might cause dizziness or fatigue, as it can amplify the effects of blood pressure medications. And let's not forget those with allergies. If you've noticed skin irritation, rashes, or other allergic symptoms after eating or handling garlic, it's best to steer clear. Pregnant and breastfeeding women should also exercise caution. While a bit of garlic in your meals is generally safe, large amounts could affect your baby's digestion or flavor breast milk in ways your little one might not appreciate. Listening to your body and consulting with a healthcare provider can help you determine when garlic is right for you and when it's better to skip it. Tips for safe use. To enjoy garlic's benefits without running into trouble, a little care goes a long way. Start small, especially if you're new to using garlic regularly. Adding a clove or two to your meals can provide health benefits without overwhelming your system. For those with sensitive stomachs, cooking garlic instead of eating it raw can reduce its intensity and make it easier to digest. If you're on medications, space out garlic consumption by a few hours or consult your doctor to avoid potential interactions. And when using garlic topically, always dilute it with a carrier oil to prevent skin irritation. A quick patch test on your wrist can save you from unexpected burns or rashes. Proper storage is key. Keep garlic in a cool, dry place to preserve its quality and potency. Fresh garlic offers the most benefits, so don't hesitate to replace old cloves if they've sprouted or softened. By following these simple tips, you can make the most of garlic's incredible properties while staying safe and healthy. Don't forget to share this with your friends on WhatsApp. There's always someone who could benefit from knowing how to use garlic wisely.